Tuko kwenye studios za C4 TV na leo tuna mgeni wetu ambaye ametoka kwenye hospitali ya Greencard Family Health Center na atakuwa na mengi kutujuza kuhusu habari za COVID na maendeleo yake, lakini pia kuna mengi ambayo ametuletea na utaenda kumsikiliza mwenyewe. I would just try to introduce our guests and to tell them we will be having you here, and you give us awareness about COVID-19 and how the statistic is from where it started up until now, and then we'll cover a lot of things. You can just introduce yourself. What's your name? Where you're coming from? And even your professional. Welcome.
Okay, so I'm Dr. Elisburg. I'm a board-certified pediatrician. I work for Family Health Centers at the Iroquois location on Taylor Boulevard.
Okay. Amesema naitwa Dr. Michelle, anafanya kazi na Family Health Center pale Iroquois Taylor Boulevard, na leo tuko na studioni kwetu kwa sababu ya kumuuliza baadhi ya maswali kuhusu COVID-19 au corona. Okay, maybe my people, my audience would like to know how the statistics is from then to now, how the statistic is.
So currently in Kentucky, there is a dashboard that anyone can go to. Right now, the latest is maybe 3 deaths in a week, which is compared to the peak last year was about 432. So it's much less, it's much less serious right now.
Okay. Nilikuwa ninamuuliza inakaaje statistics au kwa Kiswahili tunaweza tukasema uambukizwaji wa watu ukoje kutokana na mwanzo mpaka sasa hivi. Amesema kwamba sasa hivi kuna unafuu kwa sababu mwaka jana na ukilinganisha na miaka mingine iliyopita hali ilikuwa ni mbaya. Watu walikuwa wanasumbuliwa sana na magonjwa. Idadi kwa wiki ilikuwa ni 4,000 na kwenda juu, lakini sasa hivi kuna kidogo ya unafuu. How many kinds of vaccine do you have for COVID-19?
There are 2 brands. Another one may be coming out. There are a few brands. They are all good. Whatever brand you get doesn't matter. But the newer version of it is a bivalent version, and that's the one that people are getting now. The initial vaccine was monovalent. There was 1 strain in it. The bivalent has 2 strains, and they are updated for the most recent strains. Like Omicron is the newest strain as this virus keeps changing. It's the same virus, but just little differences in it make different strains. And so right now the bivalent vaccine is the one people want to get.
And when it's changing, you change the vaccine too?
So initially the vaccine came out very quickly. This was a new virus never before seen in the world. So there was a lot of science making a vaccine for that first strain. That was, 3 years ago. Now, as this strain, there have been multiple different strains that have happened. There's a new version of the vaccine that is out that has the newer versions of the new strains in it.
And what are those 2 vaccines was before the bivalent?
The one before it was a monovalent. It had that novel coronavirus 19, what they're Greek letters. They would say alpha would be the first one. Then we had a delta. Now we have an Omicron. So there have been multiple strains that have come. The monovalent was for the original one. That one doesn't really work anymore because that virus strain is sort of gone. And now the virus has mutated and changed to the newer versions, and the bivalent one now, which has 2 strains, has the one that is the more current virus strain that we're seeing in the communities. So the bivalent vaccine is the one that people want to get now.
Okay. Nilikuwa ninajaribu kumuuliza kuhusu habari ya ni aina ngapi ya chanjo inaendelea. Akasema kwamba mwanzoni kulikuwa na aina 2 ya chanjo ambayo ilikuwa inafanya kazi. na baada ya hizo aina mbili ya chanjo kuna kuja nyingine sasa hivi ambayo ni mpya inaitwa bivalent, na hiyo hapo ndio ambayo ina nguvu kutokana na nguvu ya kirusi kilicho sasa hivi, kwa sababu kikawaida virusi vinakuwa vinabadilika. Kilichokuwa mwanzo na sasa hivi sio kile kirusi. Kwa hiyo inakuwa na hali ya kubadilika, na inapobadilika wanasayansi pia wanaendelea kujikita katika kuleta dawa mpya au kuleta chanjo mpya itakayoweza kutibu hicho kirusi kutokana na hali ya hewa inayoendelea. Na ametaja baadhi ya chanjo zilikuwa zinazofanya kazi kutokana na virusi kama kirusi cha Delta na vingine vingi alivyovitaja kama mnavyomsikia. Another question is because I'm here as I told you before that I'm here on behalf of my community, my Swahili community. So I have to whatever I ask you is from my community. Mm-hmm. Yes. What about now about the faith or religion? Is there a religion attached to this vaccine?
Okay, I have not been asked that question. No, I do not believe that there is a faith attached to that vaccine. I'm not even sure where that comes from. Okay, so no, I believe the vaccine, I mean, I'm a scientist, I'm a doctor. I go by evidence and science research. And so this vaccine is manufactured for science. It's medical. It's meant to help prevent really serious disease, the same as every other vaccine that we have. People have different faith beliefs, and so they can have individual beliefs about what they believe about vaccines. But as far as the vaccine itself, there's no faith attached to it. I mean, I know I'm Jewish and we believe, sanctity of life. You do.
Are you Jewish?
I am Jewish. Wow. Yeah, I'm Jewish. And so ours, pikuah nefesh, to save the world, you save a life, you save a soul. And so whatever you can do, like we're required to get vaccines because whatever you can do to protect life, you would do. I know from some Muslims too that that's the same thing, that you have the ability to take care of your body and do something that's safe. That's a thing for some Muslims too. So I think you have people have personal faith ideas about how they feel about vaccinations, but this vaccine is a scientific, research, evidence-based medical intervention, like all the other vaccines and medications and things that we do for medicine.
Yeah, why I'm asking this question because a lot of people, they do not want to take the vaccine because of their belief. They believe maybe from what they read from, I don't know, from the Quran or from the Bible, there's something which has been said, blah, blah, blah. And they say, okay, we cannot take this vaccine because this vaccine maybe is the way the devil will pass through. So maybe how do you perceive that?
So again, people have their own individual faiths. I do not believe that is, that's not how I read the Hebrew Bible. I know about the Quran. I know about the Christian Bible. I don't believe there is anything in there that says that. I think people have personal beliefs and maybe they have heard something. I think it's, of course, important to talk to your own community faith leader. And it would be interesting to find out, a lot of these things come out of fear. And unfortunately in our country, instead of following science and just learning and taking care of people, we've had a lot of fear and misinformation and made this a political thing that people hear all kinds of stuff rather than looking at the evidence. And so somebody probably started that story out of fear and then it got passed around and everybody believes it. I would think it would be important to talk to your own personal faith leader to see if a faith leader really says that. I'm sure somebody believes that, and that's your personal right. I would say that I don't believe that personally. I don't believe that medically. I think if you talk to enough faith community leaders, I think most people who lead communities of faith want to do what's right for people medically and save lives. And so I don't believe that that's, I don't really think that's really how it works. I don't really think that's a thing.
Yeah, let me translate to my community.
Without insulting anybody, but
yeah.
that's just not really what I would, that's a new one.
Yeah, nilikuwa ninajaribu kumuuliza mtaalamu wetu kuhusu habari za chanjo na imani. Inaingilianaje chanjo na imani? Je, kwa sababu kuna watu wengine wanasema hawezi kuchukua chanjo kwa sababu ya imani zao, na ni kitu ambacho ni lazima tuweze kumuuliza. Akawa anasema kwamba yeye ni mwanasayansi na anaamini sayansi kwa sababu anaenda kwa ushahidi, na ushahidi unaonyesha kirusi kipo na dawa ipo. Hawezi kuzungumzia sana kuhusu kwenye habari za imani. Labda kama kuna viongozi ambao wanasimamia imani, wanaweza wakaulizwa maswali, wanaweza kujibu zaidi, kwa sababu yeye kwanza kwenye imani ni Myahudi amesema, na anaamini Wakristo wanajua wapo pia na Waislamu, lakini yeye kuna kitabu anachosoma ni cha Wayahudi, na kila akimzuie kufanya nini kuweza kuchukua chanjo au kuweza kuambia watu wengine waweze kupata chanjo. Kwa hiyo ndicho anachoamini hicho. Now my next question is what the government plan to do to those who doesn't want, to those who don't want to take the vaccine.
So there are no longer any mandates for getting vaccinations. There was, this has now been 3 years later. There was a public health emergency that was declared where the government made some decisions to try to save, to protect the community, the public's health. I believe very firmly, I have a master's in public health. So I think about a population-based approach. So when there's a public health emergency, the role, at least for me, the government, is to make sure as many people are as safe as they can be and protecting the community as a whole. And so sometimes there are rules and things that happen to protect as many people as possible, because this was a very transmissible infection. It killed, 1 million people. It killed a lot of people. And so there were some rules and things that came up in the beginning to try to protect a lot of people. The public health emergency has now been declared over. The World Health Organization has said it's over. The United States internally has said it's over. So those emergency measures that were happening are no longer happening. So there really are no government mandates or anything. Nobody's forced to get a vaccine. Nobody, there may be private businesses that require certain things. I believe a lot of that has eased up over time as there is less COVID, fewer people getting sick. But I think the one thing I want to say, I think a lot of people talk about the government forcing people to do things. And I think we have to be really careful. In China, they barricaded people in their apartments and bolted doors and welded them in and things like that. That did not happen in this country. And nobody came to your house and strapped you down and injected you with a vaccine, right? Nobody forced anything on anyone. There were some decisions made to try to protect the community from a very highly transmissible infection. But at this point, there is, the disease is under enough control. There are treatments for it. We know how to treat it better. People are not dying as much. And so the government isn't going to do anything to you. But you might get sick. You might get very sick from COVID, but the government is not controlling anything about your choice to get a vaccine or not get a vaccine.
Nilikuwa ninajaribu kumuuliza kwamba serikali inafanyaje kwa kuwasaidia wale ambao hawataki kuchukua chanjo. Amesema kwamba mwanzoni ilikuwa ni lazima kuweza kuchukua hizo chanjo, na walikuwa haikuwa lazima. Ninamaanisha kwamba walikuwa na hatua walizokuwa wanachukua kuhakikisha kwamba watu wengi wanalindwa, na walikuwa wanatoa labda masharti kwenye baadhi ya sehemu, kwenye mkusanyiko wa watu, ili kuhakikisha watu wanaweza kulindwa. Hiyo ilikuwa ni mwanzoni, kipindi ugonjwa wa corona unaingia, lakini baadaye hivyo vizuizi havipo tena. Kila mtu anaweza kufanya, akitaka kwenda kuchukua chanjo anaweza kwenda kuchukua chanjo yeye mwenyewe akijisikia, lakini vile vizuizi havipo. Lakini mpaka sasa hivi serikali inaendelea kuwasii watu kama inawezekana waende kuchukua hizo chanjo, lakini hakuna tena masharti kwamba ufanye hivyo ufanye hivi. Labda masharti yanaweza kubaki kwenye mashirika ya kibinafsi, lakini serikali kama serikali haijafanya hivyo na haijawahi kuja kumgongea mtu kwake au kumkamata kwa nguvu ili kumdunga sindano ya chanjo. Now I have another point which have been sent from my community about the Greencard. You say that there is no any mandate of COVID-19 vaccine. So how to get the Greencard? What they really require from now on?
So the Greencard is different, right? As a whole, people working and living, there is no government mandate or requirement to get vaccinated. There are personal, individual circumstances. A Greencard is an immigration issue, so that is a totally separate consideration. Currently, the most current requirement now is that to get a Greencard, you will need to have a COVID vaccine. So if you do want to get a Greencard and get residency, legal residency in this country, right now you still are required to get a COVID vaccine for that particular status.
And how long this mandate will be?
Nobody knows, right? So the public health emergency just ended a week or two ago. So they are slowly, I believe they have just taken away requirements that people who come from other countries to visit don't need COVID vaccines. So will they change that requirement? I mean, I don't work for the government. I have no idea. I would suspect that as time goes on and these public health emergency is now over, it would not surprise me if they would not require that anymore. But immigration has its own specific rules and requirements. Yeah. So currently it seems that is still required. It wouldn't surprise me if that did change in the next, few months or so, but who knows, right?
Yeah. Nilikuwa ninamuuliza pia swali lingine kuhusu kama anasema kwamba serikali imetoa masharti yote kwenye habari ya imejaribu kutoa, sio yote lakini imetoa masharti ya kutosha kwenye habari za chanjo, kwenye habari za corona. Sasa inakuwaje mtu kuweza kupata green card mpaka aweze kuwa na chanjo? Yeye akasema kwamba hiyo sio ya kwenye kitengo cha afya, hiyo ni kwenye kitengo cha uhamiaji. Uhamiaji ndio umesema hivyo kwamba ili uweze kupata green card na uweze kuendelea kuwa mkazi halali wa Marekani ni lazima wanahitaji chanjo ya corona ambayo utakuwa na kadi utakayoonyesha ili uweze kupewa hiyo. Lakini pia nikana nimemuuliza hayo masharti au hivyo hayo masharti yatakaa kwa muda gani? Akasema yeye hana wazo kuhusu ila ajui kwa sababu yeye yuko kwenye kitengo kingine, ingawa anafanya kazi serikalini, lakini pia hicho ni kitengo kingine ambacho ni kitengo cha uhamiaji ndio kimetoa hiyo misisitizo ili mtu aweze kupata aweze kupata green card ni lazima aweze kupata chanjo. Kwa hiyo wewe ndugu yangu unayenisikiliza sasa hivi, unaniangalia kwenye TV yako, hakuna green card bila kupigwa chanjo ya corona. Ndivyo doctor amesema. Okay, before we wrap up, can you give my community awareness about the COVID-19, how the situation is currently?
Currently, there still is coronavirus around. It's going to be like most viruses. It's going to come and go and come and go. Mm-hmm. The disease burden, it's much less than it was. Mm-hmm. There are not as many cases. They are not as serious as far as people dying and being in the hospital. We have treatments now. We have medications and things and ways to treat it that way in the beginning we didn't. So we do have treatments for it. The new strains do seem to be more mild for most people. There are people that are at higher risk. So if you are elderly, more of the cases are of hospitalizations and death would be people over age 65. So if you are older, if you are immunocompromised, you have any specific medical conditions, cancer, or you take medications that affect your immune system, people like that are going to be at higher risk. There still are concerns for COVID. It doesn't just kill people. There's what's called long COVID, so that even if you have a mild disease and you get better, it leaves a lot of respiratory problems, a lot of problems that can last for months and months and months. So people really think about, as long, people don't die from COVID, so what do I need a vaccine for? But there are things that happen besides just dying, right? So there are long-term consequences, and you don't know if you're going to be that one to have it. So the vaccine does protect you from hopefully getting in the hospital, hopefully keeping from having very serious illness, a very serious illness, having the long-term problems that linger for a long time. So that's where we're at right now with COVID. But it could change, right? It's changed all along. I think it's never gonna go away. I think we're gonna be seeing where cases surge and then they get better. So, I think it's something that's gonna be around for, like the flu. It's gonna be around.
Yeah, lakini pia nimemuuliza swali lingine, sio swali, nilimwambia anaweza kutupatia elimu kidogo kuhusu Covid-19, jinsi ilivyo sasa hali. Akasema kwamba hali kwa sasa sio mbaya kama ilivyokuwa mwanzo, kwa sababu sasa hivi kuna unafuu ambao unapatikana. Ni kwamba sasa hivi dawa zipo hospitalini, ambayo mwanzoni dawa zilikuwa zipo, lakini pia hata sasa chanjo ipo. Ila sasa kuna makundi ambayo yako kwenye hatari sana, na makundi ambayo yako kwenye hatari sana ni kundi la wazee, ni kundi la watu ambao wana magonjwa sugu, ni kundi la watu ambao wako kwenye mwendelezo wa kutumia dawa, kama watu wenye kansa na makundi mengine. Hao ndio kwenye hatari kubwa. Lakini pia ni ugonjwa ambao ni endelevu. Mtu anaweza kusema okay, mimi kwa nini nichukue chanjo na wakati mimi corona yui. Lakini sio tu kuua, inaweza kuachia matatizo kama ya nini, matatizo kama ya kupumua, matatizo kama ya kiafya, inaweza kukuachia tu matatizo. Kwa hiyo ni vizuri uweze kwenda hospitali na kuweza kupata chanjo kwa ajili ya faida yako. Let me say thank you for your time, and it was a blessing to my community to having you in the studio. And if you have anything you have to say before we wrap up, you're welcome.
Okay. So I think I just want to make sure people understand, you ask some really interesting questions, and people have faith-based things. They worry about the safety of things. I think it's really important that people be very careful where they get their information, that when you're Googling, you be very careful and you look at where your information comes from and what those people are trying to get you to do or not do. And your medical providers, I'm at family health centers. We have our multiple clinics. We have interpreter phones, so we will speak to you in your language. But bringing these questions to your medical provider to go through, if you've heard of something, some things are true, some things are rumors. But bringing your question, don't do something that could save your life. Go to your doctor, go to your nurse practitioner, your medical professional, and ask these questions. We will talk you through what is true, where the evidence comes from, try to answer your concerns. Because we, of course, we want to save lives. We want people to be safe and healthy, and we are here to have a conversation about what people's concerns are, so that you can make an informed and educated decision about what's best for you and your family.
Okay. Nilikuwa ninajaribu kumuuliza swali la mwisho kuhusu kama na kitu chochote kabla ya kufunga. Akasema kwamba ni muhimu, kama una maswali yoyote, kama unaweza ukawa na concern yoyote, usiishie, kwa sababu kuna taarifa zinakuwa ni za ukweli na zingine sio za ukweli. Nenda kwa dokta wako, ukamuuliza, hata kama lugha na kuchanganya Kiingereza, wana watu ambao ni wakalimani wa lugha yoyote. Ukienda pale watakusaidia na maswali yote usishie nayo huko. Okay, thank you so much.
Asante sana.
Yeah, asante.
Kwaheri.
Yeah.
Those are the words I know in Swahili.